Okay, this is the second video I'm doing on disability, and if you're watching this first, maybe try to go back and watch the first video. I talked about kind of your descent into hell, because that's what it feels like when you're going through disability. You are really you're gonna hit rock bottom at some point, and unless you are just one of the very lucky ones who just have some kind of support system and, you know, are independently wealthy or something, and you can just ride it out, you're still going through that pain. You're still going through that suffering in at least one or two forms. You might be able to escape one aspect of it, but you really, for the plain old working man or woman, you're going to go through so many tough times, and it's going to just be, it's a time where even the people with the most hope, the biggest optimists, become just pessimists. And as I said in the first one, I've known too many people who have had, you know, mental or physical issues, and they kind of go along with each other. You know, you have one, you're going to have the other. If you're in physical pain, you're going to have mental pain. If you're in mental pain, it's going to manifest into physical pain. It's just how it goes, because, you know, let's say you have mental pain and you just decide you're just going to sit around in your house all day because you're, you know, got horrible bipolar, and you're going to just, you know, it's just crippling to you, and it's going to affect your physical health, and you're going to see your body start falling apart, because your mind does manifest a lot of your reality. And I know that's that new age spiritual stuff that I really don't like to say, but there is something to it, because your mind, what you put your focus and attention to, and the way if you look at something positively or negatively, then that affects you in that way. So it's going to be a problem. It's going to be multiple problems, and you're going to have to find your way out of this. And I'm going to get to that after I kind of go through more of what you're going to go through, what you can expect when you have disability. And I want anybody who is watching this and has any questions or anything, I'm by no means an expert. I have my experiences, and I will be glad to help you in any way possible. I'm more of a, you know, I'm more of a hope bringer, a spiritual guide, than I am, you know, I'm getting advice on anything else. But I have been through a lot, and I know a lot of people who have been too. So, and I've talked to counselors who just deal with chronic pain patients, and I really do think that if you have questions, please ask me. And if I can't answer them, I will try to point you in the right direction. But mainly the biggest thing is I want to bring you hope during this time. And I know I'm going through a lot of, like I said, the 7 levels of hell, probably more than that with depression. But, you know, you're going to go through that, but you're going to come out on the other side. And I'm going to talk a lot about that, maybe even in the third video. But this one I want to get more into, again, what you can expect after. So we've gone through the initial. You have your dealing with your initial pain. So you're, you know, you're unable to do a lot of things that you used to do. You're unable to go out and enjoy yourself like you used to. Your family life starts to crumble because everyone's depressed and bitter, and your social life starts to crumble because nobody wants to be around you when you're just a downer, and they don't want you to bring them down too. There's very few people who I know. I mean, I wouldn't have wanted to be around somebody who's just awful, an awful person, because they're just so bitter because life has just put them in pain all the time. It's sad, but that's just the reality. So you have to accept these realities. You have to clear your mind to work with what you've got in front of you and just stay the course and just look at one thing at a time. Don't start fretting about what's coming up in the future, because there's going to be hard times definitely in the future, but you don't know what they're going to be. You know, I'll give you some tips of like what's going to come, some of what happened to me, and you can kind of be ready for these. But I'm not telling you this to get you even more down and be like, oh, well, all this stuff's going to happen to me, so oh man, this is just awful. I just want to end this all right now. No, I'm telling you this because I am 14 years into my disability now, and I was at the lowest point of my life, the lowest point of my happiness level ever, and now I am at the all-time top of my happiness. And that doesn't mean I have a perfect life, by no means. Oh, I have a lot of problems, and I could sit here all night listing them, but I am at a point where I have such inner peace that I never thought it possible. And you know what? This stuff you're going through, you have to go through it, and you have to get through the other side, and then you will realize this has brought me a type of wisdom that I never would have had if I would have stayed on the course that I was going before, just a normal average life, doing whatever I want, whenever I wanted, or whatever, going to work every day and providing for my family and doing great. This is going to give you a fresh perspective on, it's going to help you have empathy for others. You're going to most likely find a type of work to do, so you can make money, something you are able to do still. You're going to find just different ways to adapt. Adaptability is the biggest issue when you have to be able to adapt, and you better learn that now as quick as you can. You can feel sorry for yourself for a little while. Nobody's gonna judge you for that. I mean, some people might, but who cares? You're not worried about stop worrying about what anyone else thinks, except for your family. You do your best to kind of help them along too, but you cannot do everything. You're not some divine being. You are just a man or a woman who is going through an awful time, and you need to put some attention on what you're going to do with your life now. Okay, so I've gone through the kind of crumbling of your relationships and your family life and your social life. Another problem that I found is now, since society is going to judge you however society judges you, and they're probably going to judge you harshly. And chances are, if you have some kind of back issue like that, you're going to need pain medicine. And when you get pain medicine on a regular basis for any amount of time, then people start to say, oh, you're a drug addict. It's just going to be reality. You're going to have to deal with people judging you, and that includes the people at the pharmacy most times. The people at the pharmacy are just, they are just regular people too. They're not anything different. They're going to not care if you run out of your medication and they don't have it restocked or something, and you got to wait a week for your medicine. I've been told several times. Oh, well, that's great. So I'm going to go through withdrawals and have extra pain on top of my pain, my mental and my physical pain that's already there. And everybody's going to think I'm a drug addict, and now I'm going to look like a drug addict because I'm going through withdrawals and sitting here looking like a crackhead looking for a fix here. It can be a spiral. And I will go through some of the things too, and I guess I'll go through that now. One thing for me, look into more natural things for your pain. And by that, I mean, you can't always use cannabis, smoke weed, or eat edibles whenever you are on opiates or something, because a lot of times they'll drug test you. But there are some cases where I told my doctor I was gonna try to move to Colorado or something because I wanted to go to a place where cannabis is legal so I could do it for my pain. I'd done it, since I was a teenager. So I was already familiar with it, but cannabis can help you tremendously. And if you have nerve pain like that, maybe try an edible or something. If you're allowed to, I understand if you're not, then don't put your, the pills that you need or whatever in jeopardy by doing this. But if you're able to, or maybe even talk to your doctor about something like this. A lot of times doctors don't like it and aren't going to be supportive of it because they are shills for the drug companies and they just want to push the actual opiates on you. But one thing too that you can do even when you are tested is kratom. Now, kratom has been a lifesaver for me. When I heard about kratom on a podcast one time, I decided to order some and I tried it for the first time. It was amazing. It doesn't get you high like an opiate. It is more like it does what an opiate does, only better for the pain, I believe. I think it's one of the best pain relievers there is. But kratom is going to, even if you're going through withdrawals, people use kratom for heroin withdrawal and stuff like that. You can go through this, and the kratom it's a lifesaver. Just look at that as an option. I'm not saying to try it because everybody's different. Everybody has different reactions. Everybody has different biases. Everybody has this and that. For me, kratom did exactly. Opiates not only help my physical pain, but they also help my stomach. I've had IBS, and so I've had basically diarrhea since I was a baby. Kratom does the exact same thing that opiates do as far as kind of stopping you up and slowing your bowels down. So if you have some kind of autoimmune disease, it might even make it worse, but for me, it made it better. So only you know your body, only you can decide these things, and only you can try that. So one of the final things that I kind of, the main things that really were a problem for me was if you're a man especially, but even women, your identity is, a lot of it is being a caretaker, being a husband, a father, even a son or brother or sister. You have that identity tied into you because however long mankind's been around, that's how it's been. The man was the provider, the woman the gatherer, staying at home with the family. But whatever your identity. Okay, I just had a phone call there. Whatever your identity is tied to that, your job and being that provider, and you need to, unfortunately, that is going to be one of the biggest struggles. For me, it was. We decided to have kids after I was already on disability, and that was one of the scariest things for me too. If you have kids before disability, man, it is terrifying. So that is one thing you have to come to terms with. You are not your job. You are not some one thing. Whatever you created your identity into, that is not really you. You are a spiritual being. And this is where I really want to get into the hope aspect of it all. And I see I'm kind of running long here and my phone doesn't have that much memory. So I'm going to do a third video on this. If you have time to watch it, I know if you're going through this, please leave a comment and please tell me anything that you're struggling with, or, if you need help with anything, I will do my best. I'm not promising you I'll have answers for you, how to go and, apply for disability and stuff like that. You're going to have to try to find that on your own, but I can try to point you in the right direction. And I will do my best for that, as soon as I can. So I'll have one more video on this, and that'll be the hope And that's the most important video, I think, of this all.